Hello, are you someone who is dissatisfied with your breast size? Do you feel like they could be a bit bigger or prominent? Do you in the mirror feel like that you could do better size of your breasts? Well, I'm here to tell you that you absolutely can. Hi, I'm Dr. Rajat Gupta, a board certified plastic surgeon working in Delhi with over 10 years of experience in aesthetic surgery. And today I want to talk to you about breast augmentation or breast enhancement surgery. Now, one of the most important questions I get most often asked by my patients: can breast augmentation by implants cause breast cancer? And the answer is no. Scientists have been investigating for long a possible link between blood cancer or breast cancer with breast implants, and they have found none. So, breast implants cannot cause cancer. But at the same time, let me also tell you that there is something called as breast implant associated lymphoma. It's like a blood cancer which has been found in some cases of textured kind of breast implants which can cause capsule formation in certain individuals. So one has to understand what is a capsule and how to prevent capsular contracture in breast augmentation surgery, because that's the key. Prevention of capsular contracture is the key in breast augmentation surgery to make sure that your procedure and the recovery is totally uneventful. All the cases of breast implant associated lymphoma has been found in those individuals who had capsular contracture. So let's understand what is capsular contracture, how it happens, and how to prevent it. You see, when we do a breast augmentation procedure, one of the methods we use is implants. Now, when a foreign body or a substance like implant is introduced to your body, any body reacts and forms a natural reaction of a thin, soft layer around the implant. This is called as capsule, which is a normal reaction of any body. But the problem is, if this capsule becomes hard, because normally this capsule is soft and thin. However, sometimes with infections or some other reasons, this capsule can become hard and cause capsular contracture. Now, this contracture significantly affects the area around the implants. The area can become painful to touch. The contracture can change the shape of your breast as well as the implant. It even has the ability to change the shape of the implant and may cause even rupture. So hence, we have to necessarily avoid capsular contracture. I have a video in which I have told you multiple steps about how to avoid capsular contracture. Do watch that video and you'll find that useful. One of the most important things which I use for preventing capsular contracture, I was the first one to start in India, is using of implant funnel. This funnel helps making sure that the implant is not made to touch with any part of the skin during the insertion, hence prevent capsular contracture and prevents cancer. So we need to be prepared for all these things whenever we go for any surgery. So capsular contracture needs to be prevented. Make sure your surgeon use the safest methods for breast augmentation so that the surgery is uneventful as well as your post-op recovery is safe. There are multiple types of implants as well which is used in breast augmentation surgery. These are textured implants, these are smooth or nanotextured implants. Now, all the cases of breast implant associated lymphoma has been found in textured implants across the globe. I've not been using textured implant myself for the last 7 years. I've always been a fan of either smooth implants or nanotextured implants. Smooth implants are something which you can see through, they are transparent, and nanotextured are translucent. The textured ones used to be opaque. So the nanotextured ones were developed in recent years, making sure these are safe implants as well as has the advantage of making sure that the implants does not move from wherever pocket we put it. To summarize, smooth and nanotextured implants are their safest bet. That's why I've been practicing using these implants for the last 7 to 8 years. I make sure that my implants which I use are either made in UK or made in France. To be honest, I don't use any Chinese or Korean implants. Now, the implants which I use are top quality 7th generation high cohesive gel implants, and they have no problem whatsoever. There are different techniques in which the implants can be placed, a subfascial position of implant placement or a dual placement. Each of them have their own advantages and disadvantages. The subfascial gives you a much more upper pole fuller look. The dual plane gives you a much more natural look. I decide upon the technique of placement of implant depending on what a patient desires. I discuss with my patient, I show some of their pictures so that they get an idea of what the result they want, and then I go ahead with the surgery. See, the goal of breast enhancement surgery is to be completely safe as well as natural looking results. Using these highly sophisticated implants and precise methods, I achieve this. We also use something called as 3D simulation technology to give you an idea what different size of implant will look like on you. I use something called as chrysalix simulation. I was again the first one to bring chrysalix in India. So it helps you to know exactly what implant will suit your body, how each size and shape of implant will look good on you, what will be their aesthetic appeal, how they will look good on you when you are lying down. You can see all these things using chrysalix simulation so that you get a clear idea of what to expect after surgery. Using these technologies, our patient satisfaction rate has gone up to 100% in our practice. Now, there are different kinds of incision to be used for breast augmentation surgery. Either one can use an axillary approach or a periorbital approach or an inframedullary approach. It has been conclusively proven that using inframedullary approaches prevent capsular contraction. So that's what I use. Inframedullary approach also makes sure that the scar is never visible even if someone is standing naked. So one has to understand there are different things one has to discuss with their surgeon before they decide to go for breast augmentation. One is the approach to plan breast augmentation, what incision they will give. The second is what plane you will put in a breast implant, subfascial or dual plane. And the third is the size and shape of implant. I use chrysalix to decide that. And the fourth, what are the steps taken during the surgery to prevent capsular contracture, hence making sure that the procedure is absolutely safe. Let me also bring one more topic here before I close. I get a lot of patients asking for a breast augmentation, but they're confused whether they have a sagging breast or a smaller breast. Let me tell you, if you have a sagging breast and you go for an implant in your sagging breast, that breast is going to sag more. So if you have a sagging breast, what you need is a breast lift surgery, or also called as a mastopexy. If you want an increase in size at the same time, that can be done. That's called as a mastopexy augmentation. But if you have a sagging breast, please go for a mastopexy procedure and do not think putting an implant will give you an upper pole fullness, because that implant will make your breast sag more. So if you have a breast sagging, go for a breast lift surgery. Increase in size can be done at the same time. If you do not have a sagging, you can go for a breast augmentation procedure if you want an increase in size of the breast. I hope I have answered most of your questions regarding breast augmentation surgery. If you have more questions, feel free to write in to us. I'll be there to answer all your questions. Please like, share and subscribe my channel so that we can give you more informative videos regarding cosmetic surgeries. Thank you.